Healthcare providers today collect a lot of information about their patients. Each visit in hospital means pages and pages of data. With hospital liabilities and patients' health in mind, healthcare providers need a way to convert important information, physician notes, discharge summary, nursing notes, and test reports into a structured format that can be analyzed and reviewed. Hence, they're looking for solutions to go paperless and secure the data. Now let us take an example of Arjun and his healthcare providers. Arjun promptly arrives to the hospital for his checkup. Arjun starts to get impatient as he waits for his turn. Dr. Manish finally arrives and walks in hurriedly. Arjun is called inside for his checkup. As he walks in, he starts complaining about his persisting problems. Dr. Manish asks if he has brought his previous prescriptions and test reports. And Arjun gives a simple no nod. So the doctor calls the nurse to get Arjun's records. To keep Arjun engaged, Dr. Manish starts with his consultation. But what is Dr. Manish actually thinking? How to keep a tab on all hospital-related information? While the nurse has gone to bring his records, Dr. Manish starts examining him and prescribes a set of medicines. The nurse hands over Arjun's medical records to Dr. Manish and he exclaims on finding that the medicines he just suggested were already recommended. So he gives another set of medicines to Arjun and asks him to come for a visit after 2 weeks. Dr. Manish still wonders if there is a smarter way to bridge the gap between his patients and the hospitals that helps to collaborate diagnosis and treatment plans and removes information barriers. While Arjun ponders, can't his doctor have a complete access to his medical records and his entire family's medical history anytime, anywhere? Let us take a leap in making a better community with better care.
Paper-based medical records are a recipe for confusion. Wouldn't patient care be much easier if doctors could manage their records electronically? Now they can.
Electronic health records do all the things done by EMRs and more. EHRs focus on the total health of the patient. EHRs are designed to reach out beyond the health organization that originally collects and compiles the information. They're built to share information with other healthcare providers, such as laboratories and specialists, so they can contain information from all the clinicians involved in the patient's care. They both capture clinical data and allow it to be searched and managed. But an EHR takes it a step further and is focusing on exchanging that data with other providers, making sure patient information flows unimpeded across the continuum of care. To fully consider the benefits of electronic medical or health records, one must consider the system they replaced: paper records. If nothing else, physicians' handwriting is so notoriously bad that it has become a pop culture phenomenon.
So, what exactly is worth knowing? Think about how many times you've used the healthcare system, how many times you've visited your family doctor, or a hospital ER, or had an X-ray, or filled a prescription. Have you ever wondered how all that information is maintained and shared between these points of care? Or if it's even shared at all? Now think about how this could affect the healthcare you receive. Look at it this way. You visit a local walk-in clinic where the physician requests a number of tests. Unfortunately, those test results may not always be shared with your family doctor. A month later, you experience similar complications, and your family doctor performs the exact same tests. Wouldn't it have been easier and more efficient if your doctor could have accessed those original results first? In your community, when you visit any point of care, information is collected regarding your health. However, because these systems don't connect, information cannot be easily shared between healthcare providers. So when a doctor is treating you, there may be pieces of your health information out there that they don't know about. Now consider how important communication is in an urgent situation. Say, for example, you find yourself in an ER and you're unable to properly relay your medical history. Not knowing for certain if you're on any medications or if you have any allergies could hinder the doctor's assessment and even cause problems during treatment. Retrieving your health info instantly could have saved time and reduced the possibility of complications. You'll know your healthcare provider has access to your health information because knowing is better than not knowing. So, how can connected electronic health information systems improve care for patients, make healthcare workplaces more efficient, and help sustain our healthcare system for years to come? Think about the number of times you've had to recall a patient's history and can't quickly find what you were looking for. Or the number of times you've been waiting for a lab or diagnostic result to make an informed decision about your patient's treatment plan. Or wanted to change a patient's medication, but were without access to pertinent medication information from other healthcare providers. Have you ever wondered if there was a better way for you to capture, use, and manage this exchange of health information among clinicians? Or even if it's possible to have a more complete picture of your patient's health history when or where it's needed? Wouldn't that help you provide the best possible care to your patients? Look at it this way. In your community, health information about patients is collected in various points of care, which often don't connect. So information cannot be easily shared between healthcare locations. This means clinicians often have to rely on the memory of their patients or family members who convey their understanding of the diagnosis and treatment plan. Having fully connected electronic health record systems will allow all authorized clinicians to retrieve a patient's health information quickly and securely. Not only will it save healthcare teams time, it will avoid potentially harmful errors and adverse drug events. And at the end of the day, that gives you the confidence that you will continue to provide the best possible care for your patients. Because knowing is better than not knowing. But knowing the plan to make this a reality is a different story altogether. It's about more than just entering patient information into a computer. It's about creating a network of different systems that can connect and share health information to authorized clinicians where and when needed. Sounds complex, doesn't it? Well, it is. It's an initiative that needs to be well thought out and done responsibly. With health information being of a very sensitive and private nature, this network of systems must respect all privacy laws. It also has to be designed and created so that it aligns with professional practice, regulations, and health policies. The information stored includes unique information that identifies the right patient with the right health record, clinician information that securely links authorized healthcare providers to their patients, all laboratory work, all medications, allergy or immunization reports. The final component, connection, allows a complex variety of patient information to be quickly accessed and easily updated by authorized clinicians. Clinicians will see the most value in this component as it allows for the exchange of pertinent patient health information between clinicians at different locations who are caring for the same patient. Connection, the most challenging component, is also now gaining momentum. It's about more than simply connecting facilities through technology. It requires an ongoing dialogue between practicing clinicians, healthcare leadership, and technology experts so the electronic exchange of information fits with clinical practice needs and aligns with required processes, regulations, and health policies. Working together, the provinces and territories and the healthcare community are on a transformational path and continuously uncovering new and innovative approaches to electronic information sharing with healthcare providers. Clinicians today are already seeing some of the benefits of using health information technology to provide better, more informed treatment and care. Because knowing is better than not knowing.